Hi, my name is Dr. Lisa Peters. I'm a board-certified plastic surgeon, and today I want to talk with you about some of the most common concerns that patients express to me when considering plastic surgery or a cosmetic procedure. So the four most common things that people mention to me are safety, pain and recovery, looking natural, and what other people are going to think if they have a plastic surgery procedure. So let's address each one of those things. Safety. Yes, plastic surgery is surgery, and with any surgery there are risks involved. One of the parts of any consultation and preoperative process with each patient is to discuss the safety of the procedure they're considering, not only the procedure itself, but their medical history to make sure that that procedure can be as safe as possible for that person. Specifically, one of the things that patients express a concern about with regard to safety is anesthesia. Many people have a fear of anesthesia. And what I would like to say about that is that yes, of course, there is risk associated with anesthesia, but anesthesia for someone who is otherwise in good health is quite safe. I have been a patient before. I have had surgery before. What I like to tell my patients is that I have never worried for my own safety when I am going to be undergoing anesthesia because I'm healthy and it is safe. And the risks are small for somebody in that group. But of course, those concerns can be discussed on an individual basis. The second concern is pain and recovery. In general, with any surgery, there is pain, of course. In general, my experience is the first 3 days after surgery are when a patient experiences most of the pain associated with surgery. And after 3 days, that pain improves pretty quickly for most operations. We work with our patients to try to manage that pain using a number of different things, not just prescription pain medicine, but over-the-counter medicines as well. But I think the most important thing is preparing the patient, letting them know what they're going to experience, because I think the unknown is difficult. The other thing that's nice about having a plastic surgery procedure with regard to pain and recovery is that I call it happy surgery. People look forward to having a procedure like this. And I find that when you're having a procedure that you're looking forward to, the pain is much easier to deal with. Sad surgery, such as cancer surgery and things, those are much more difficult recoveries because nobody ever wanted to be there. They're scared, they're in pain, they're unsure, and all of those things play a role in what that recovery process is going to be like for that patient. But in general, with the education that we do for our patients before plastic surgery, and of course the medication management that we do for our patients, most of our patients will tell me that the surgery was exactly like I told them that it would be, or better than I told them that it would be. So that's obviously a positive for both of us. The third concern people have about plastic surgery is many women, or patients, excuse me, want to look natural. They don't want to look as if they've had plastic surgery. And that's true from a surgical perspective, mostly in patients who are considering facial procedures or a breast augmentation, for example. But we hear that a lot from patients who are considering non-surgical procedures, such as Botox or fillers. And we've all seen pictures of people who have had plastic surgery procedures and don't look natural. But I think the big question is, how many people have we seen who have had those procedures and look great, and you don't realize that plastic surgical procedures or non-surgical procedures were part of the reason they look so good? And I think what's interesting is that many people, when they start to go through the process of getting ready to have their own procedure and confiding with others that they're considering having this procedure done, they're often surprised at how many people they know have had a plastic surgical procedure or non-surgical treatment that they never realized had it in the first place. They just didn't realize part of the reason they look so good was because of that help. The last thing is that many people are concerned about what others will think if they're considering a cosmetic or elective procedure. Now, when it comes to family and close friends, oftentimes that concerns comes from a place of love, where they're also worried about safety, or they love you just the way you are and they don't understand why it's important to you. And I think that's a conversation you need to have with your loved ones. And if it's a safety issue, then bring that person with you to your consultation or your pre-op appointment so that they can have their questions answered and feel more comfortable with your decision to move forward with this procedure. If it comes to coworkers or acquaintances or neighbors, first of all, it's none of their darn business what you choose to do with your body. And the nice thing is, for many procedures, whether it be injectables or body procedures, breast and abdomen, for example, they don't need to know. They may not ever recognize that you've had a procedure. Breast reduction patients in general, for example, they will have people ask them if they've lost weight because having smaller breasts makes you look like a smaller person. Facial patients, once the recovery is over, oftentimes people can't put their finger on it. They say, you look different. Did you get a haircut? Have you been on vacation? You look more well rested. You look happier. They don't know what it is. They just know you look better. So if that person's important to you, consider bringing that person with you to your appointment so that they can have their questions answered. If that person's not important to you, then it doesn't matter what they think. Do what's right for you. Of course, there are obviously other concerns people have, but these are the four most common things that people ask me about, and I hope I've answered those questions for you today. Again, my name is Dr. Lisa Peters. If you'd like more information about our practice and what we do, our website is plasticsurgeryofchicago.com. And if you'd like to schedule your own consultation, our phone number is 708-524-1400. Thanks for listening.